Hi everybody, Dr. Vito here again with West Suburban Wellness. Today I want to speak with you specifically about vertigo. Vertigo is a very common thing that unfortunately a lot of people can experience. And there's really two primary types that I want to discuss with you today. The one that we commonly think of is a sense of the room kind of spinning, having a loss of balance and orientation. And a lot of the times that can actually come from you have these inner crystals inside your ear that sit in fluid. The best way I can describe it is imagine if you have a can of spray paint, you have that little metal ball inside the paint and you shake it and there's that ball that's shifting inside the fluid, right? That same concept is applied with those inner crystals in your ear. Is if you, just like if you tip that can and the ball in the spray paint can would drop, when we tip our heads, those crystals actually move a little bit, right? And if they become dislodged from where they are and they shift too much, then that creates a disorientation sense and we're not sure where we are in space. There's some very effective techniques that can be used to actually reset those crystals. One is called an Epley's maneuver that our doctors are well versed in here in the office. And that's very important to know if it's that kind of vertigo. The technical name is benign paroxysmal positional vertigo, or BPPV, if you like to use Dr. Google. The more common one that is unfortunately not spoken about is called cervicogenic vertigo, okay? Now, cervicogenic vertigo is exactly what it says. It's generated, from the cervical spine, okay? So I want to talk about that because that's something that we very much have good success with here in the office. Unfortunately, too few people know about it. And what that is basically you have different ways that your brain perceives where you are in space. One of those ways is with our sense of sight, right? Obviously, if you see the room tilted like this, then something's going to tell you that, oh, my head is tilted, right? We also use our ears and our sense of hearing to know where we are in space. But a big one is something called proprioception, and that's the information from the joints in your spine and your body sending these signals back to your brain saying, oh, this bone is tilted this way, this bone is turned this way, right? That's called proprioception. And we need that information to tell the brain where our body is in space. What can happen, unfortunately, is we can get crossed signals when our eyes are telling our brain one thing and our ears are telling our brain one thing, but our joints are telling the brain another thing. So if you have a misalignment in the joints in the neck, if the joint or the bone is stuck, it's putting pressure on a nerve and it's not evenly distributing those stresses on the joint, then what happens is we get those mixed signals because now the joint's not functioning well, it's not sending those clear information messages to your brain. So now you get those mixed signals and you have vertigo. What we do in our office is when we check the spine, we check for proper motion, we check that you're getting that proper proprioceptive input from the joint to the brain, and we've had many, many patients over the years tell us, hey, you've helped me so much, I've been taking medications for years, I've been dealing with this for decades even, and now my vertigo is gone, or when it does happen, it happens less often, or it lasts less long. So we have, again, we have very good success when it is especially that cervicogenic vertigo. If you experience vertigo or if you know someone who does and they've not had their spine checked in a long time, this is definitely something that I would recommend so we can really identify what's causing that vertigo. Is it that BPPV? Is it cervicogenic vertigo? What's the cause? Once we know the cause, then we can find the solution. Thanks a lot for your time. I'm Dr. Vito. Take care.